Dental bridges are a well-known cosmetic treatment that is used to substitute some or all missing teeth. They don't just bring back function for the mouth and allow to chew and speak properly, as well as improving the look of your smile. In this clip, we'll explore the ways dental bridges help make up the space created by teeth missing and bring back function and aesthetics of the mouth. What are dental bridges? Prosthetic dental bridges can be described as appliances that serve to replace teeth that are missing. They usually comprising two crowns which connect to the teeth either end of the gap. They are also known as abutment tooth, along with a false tooth, also known as a pontic between. The pontic is designed in accordance with the size of the tooth, its shape, and the color of the missing tooth, creating a natural, flawless final. Types of dental bridges. There are many kinds of dental bridges available, including traditional bridges, bridges with cantilever, along with Maryland bridges. Traditional bridges have crowns that are placed either side of the gap and the pontic between them, as well as cantilever bridges. They are employed when there's only one abutment tooth the other edge of the gap. Maryland bridges, formerly known as resin-bonded bridges, use ceramic or steel wings that are attached to the back of abutment teeth to support. The dental bridge procedure. The process of making an implanted dental bridge generally includes a series of actions. In the beginning, the abutment tooth are prepared through the removal of the enamel in a tiny amount so that there is room for crowns. Images are taken of the tooth that has been prepared, as well as the gap is created to form a model for the bridge. The bridge is created at a dental laboratory on the impressions. After the bridge has been made and is firmly anchored in place, returning its function as well as aesthetics to the dental. Benefits of dental bridges. There are numerous benefits to using the dental bridge. One of them is improved function, as bridges permit an appropriate chewing process and better speech because they fill in the space created by teeth that are missing. Additionally, they help stop the remaining teeth from shifting that could lead to dental problems, such as jaw pain and bite. Additionally, bridges can improve the look of a smile by filling in the gaps as well as creating a more natural look. Maintenance and longevity. Maintaining and taking care of your bridge is crucial to ensure the durability of bridges made from dental material. Brush and floss often to stop the formation of plaque and bacterial buildup within the bridge. Checkups on your dental health regularly are essential to ensure the bridge is functioning properly and address any issues that might arise. When properly cared for, dental bridges are able to endure for years as well as provide a sturdy and reliable solution to the loss of teeth. Conclusion. Dental bridges offer a plethora of and reliable treatment method to fill in missing teeth as well as restore aesthetics and function to the mouth. And bridging gaps caused by teeth missing, bridges aid in improving oral and chewing abilities as well as help to restore the natural appearance of a smile. When properly cared for and maintained, bridges for dental use can be long-term and lasting solutions for teeth that are missing. If you're suffering from tooth loss and you are seeking to recreate your smile, take into consideration the advantages of using dental bridges and talk to your dentist to determine if they're the ideal choice for you.